Hi, I'm Dr. Colley, and this is a video to help you prepare for your surgery. Let's talk about some things you can do before and after surgery to ensure a smooth recovery. Let's start with some things that you can do to reduce the amount of bacteria on your skin. Number 1, Hibiclens showers. Hibiclens can be purchased from the pharmacy. The minimum is taking a shower the night before and the morning of surgery. Specific instructions are provided in your surgical packet. Number 2, clean bedding and pajamas. Wash your sheets multiple times leading up to surgery. If you sleep with pets in the bed, keep the pets out of the bed for 2 weeks before and 2 weeks after surgery. Before surgery, you'll need to obtain a few items from a medical supply store or online to ensure a good recovery. Number 1, a front wheel walker. This is important to ensure that you don't fall after surgery. Number 2, raised toilet seat with arms. It can be difficult to get up off the toilet after a knee replacement. This is important. And number 3, compression devices for your legs to help prevent blood clots after surgery. There's more specific information in the packet on how to obtain these from Amazon. Physical therapy. A physical therapy order has been provided in your packet. It's important to schedule this for 5 to 7 days after surgery. I recommend you call before surgery because it can be difficult to get an appointment. Let's talk about some post-operative medications. Everyone will be sent with a narcotic prescription. This can be either oxycodone or hydrocodone depending on the discussion you have with your provider at your pre-op appointment. We also encourage our patients to take Tylenol in addition to their narcotic pain medications if those are not already included in the prescription. If your prescription does not include Tylenol, we recommend 1,000 milligrams 3 times per day. Do not exceed 3,000 milligrams of Tylenol per day. This is important. If you have liver issues, do not take Tylenol. Anti-inflammatories. If appropriate, you will be prescribed an anti-inflammatory. This is typically a medication called meloxicam. If you are given an anti-inflammatory, do not take additional medications such as Aleve and ibuprofen in addition to your meloxicam. Most patients will be given an antibiotic to take after surgery. This is typically done for 7 days post-surgery to help prevent an infection. Blood thinners. We put everybody on blood thinners after a knee replacement to help prevent a blood clot. Low-risk patients will be given aspirin, 81 milligrams, twice per day. Higher risk patients will be given Xarelto or Eliquis. If you're already on a blood thinner preoperatively, we will resume it after surgery. We'll also give you a medication to prevent nausea after surgery. This is typically Zofran or ondansetron. This is as needed, as not everybody has nausea after surgery. There are a number of over-the-counter medications I recommend you have on hand just in case. 1, Benadryl. Benadryl can be helpful for sleep, as that's often difficult after surgery. It can also be helpful with itching caused by other medications. 2, Colley. We recommend all patients start Colley if they're taking a narcotic medication. This can help prevent constipation. I also recommend you have Miralax on hand in case the Colley isn't helping. If you continue to have constipation, please call the office or look at your preoperative packet for more instructions. Let's talk about some supplements and nutrition that can help you heal after surgery. Surgery stresses the body. It's important to get proper nutrition and supplements post-surgery. It has been shown in multiple studies this can help speed your recovery. Number 1, protein shakes. I recommend everybody gets on a high protein diet. This is a minimum of 100 grams of protein per day. Number 2, vitamin D. Vitamin D helps support healing and bone health. I recommend 2,000 units per day. Number 3, vitamin C. Vitamin C is vital for immune and healing support. 500 milligrams of vitamin C per day for the first 6 weeks after surgery. There's information in your surgical packet about a company specializing in postoperative nutrition. This is not required, but I do encourage patients to check it out and see if it makes financial sense for them. Also, our practice offers nutritional counseling. If you're interested, please ask us about nutritional counseling and we're happy to set you up with an appointment. Showering after surgery. I get a lot of questions about this. It's important to keep your surgical dressing dry during your recovery. We recommend you leave your surgical dressing in place for 2 weeks. If it gets saturated or you have issues, please call the office. We do recommend sponge bathing for the first 2 weeks to keep your dressing dry. If you're able to seal it with a plastic bag and shower normally, that's okay as well. If your dressing gets wet, please call the office. Let's talk about some post-surgical exercises you can do right away after surgery. Number 1, don't sit with your knee bent. Keep your knees straight as much as possible. I do recommend you bend your knee frequently throughout the day, but when sitting, put something behind your ankle to ensure that you keep your knee straight. This is the most difficult position to keep it in. Everybody wants to sit with their knee slightly bent, but don't do this. Number 2, work on bending your knee frequently while sitting in the chair. Number 3, get up and take a walk every hour. This can be just a quick walk around the house. We also recommend doing frequent ankle pumps throughout the day to help circulate your blood. There are more specific instructions and illustrations in your packet. Let's talk about some common things we see after knee replacement. Bruising, very common. This begins at the knee and can track down to the foot or even up the thigh. Swelling, this is managed a few ways after surgery. Number 1, we utilize an ACE bandage to help prevent swelling in the leg post-surgery. Number 2, elevating the leg is important. Try and get the knee above your heart and the ankle above your knee to reduce the swelling in the leg. Number 3, ice. Ice is your friend after surgery. Ice helps prevent pain and swelling. I recommend everybody have at least 3 reusable ice packs around the house to ensure they can ice the knee properly. There are also ice machines available. You can talk with us about that as well. Finally, please read through your surgical packet. It has additional things that will help with your recovery. If you have any questions, please reach out to me or my staff for clarification. Finally, I take your recovery very seriously. I want to ensure that you have the best post-operative outcomes. If there's anything we can do, please let us know.